Aquaba. Hello, family. Welcome to the Actual MediView Show. Today, we're talking about one painful breast matter that humbles even the strongest African mothers: mastitis. You know that breast pain that makes you ask yourself, who sent me to give birth? Yes, that one. Mastitis simply means the breast is inflamed. It usually happens when milk is stuck inside and refuses to move, or when small cracks invite bacteria in. Either way, the breast will not keep quiet. It will shout, "My sister, come and attend to me." Mastitis comes from everyday things mothers face, like when baby doesn't latch well, milk remains inside. Like wearing tight bras, or that your almighty wrapper that presses on the breast like it's Banku inside rubber. Also, stress, because motherhood is stressful. It can also happen when there is a crack on your nipples that allow germs to enter the milk duct, hence causing inflammation. Stress is another possible cause because motherhood is stressful. And lastly, blocked milk ducts, like Lagos traffic. So the milk is stuck in the milk duct, honking, "Move, move!" Now the question is, how do you know what you are experiencing is mastitis? Very simple, you cannot ignore it. One part of your breast becomes hot, red, swollen, and hard. You may feel feverish, tired, or even have chills. Some mothers say, "Doctor, this breast feels like firewood." That's your body calling emergency meeting. When you come to the hospital, your doctor listens to your symptoms and checks the breast. Most times, no test is needed. If it's not improving, we check deeper to make sure it's not turning into an abscess. A lot of mothers ask, "Doctor, should I stop breastfeeding with this affected breast so it can rest small?" My sister. The answer is a big no. If you stop, the blockage becomes worse, Kurt. The breast gets more inflamed, so continuous breastfeeding is what will clear the milk traffic jam. And don't worry, Ferd, your baby will not complain. Your baby won't say, "Mommy, today's milk tastes like fever." No. So, if you notice the early signs, here's what you can do at home. First, continue breastfeeding or expressing the breast milk in every 2 to 3 hours.
You don't have to wait till the breast is shouting, "I'm full." Secondly,
apply a warm towel
or take a warm bath before breastfeeding your baby. It melts the blockage.
Another thing to do is to gently massage the breast toward the nipple. Not like pounding fufu, just gentle and steady. And this is very important, rest. Please, sometimes hand the baby to daddy or auntie and breathe small. Also,
drink water. Dehydration worsens the Wahala. After feeding, apply a cold compress.
It cools down the inflammation and give you a sweet relief. And lastly, avoid tight bras or wrappers. Let the breasts breathe. They are not in military training. Now, let's shake the ancient table. Myth 1. People believe in stopping the breastfeeding process because the inflammation will spoil the milk.
Well, no. Stopping breastfeeding during this time will actually make the pain and discomfort worse.
Another myth is that if one breast has it, the other breast will catch it. Well, no. Mastitis is not malaria or COVID. It doesn't jump around. Now, to prevent mastitis, here are things to do. Ensure proper latch. Baby should take nipple plus areola when feeding. Also, while breastfeeding, let the baby suck one breast well before switching sides. And don't suddenly skip feeds. Also, wear comfortable bras every time. Treat cracked nipples early. Lastly, eat well, rest, and drink water. I must emphasize that you must see a doctor if fever continues, there is pus or breast discharge, or the lump is not going away. If the pain is getting worse and/or no improvement after 2 days of home care, please see a doctor. Don't use herbs or pierce anything. We don't want new problems. Mastitis is painful, but it is treatable. Know that you are doing an amazing job as a mother. Your body has carried you through pregnancy, labor, and breastfeeding. That is amazing, and you deserve care and respect. If this video helped you, please like, share, and subscribe. I'm Stephen Adegan, and this is the Actual MediView Show. See you next time.